I'm Dr. Shelley Glover. And as a physician, I thought that I would weigh in to try to help people with some of the confusion out there about whether or not they should wear a mask or they shouldn't wear a mask during this COVID-19 crisis. So the short answer is yes, everyone should be wearing a mask. Most in the medical community have felt that way all along, and the CDC has finally come around as well. So, the reason why you wear the mask, the most important reason is if you're having symptoms to keep you from giving the disease to someone else. But because people aren't wearing masks, there are particles if someone coughs and they sneeze that are loose in the air and can stay in the air. And because of that, we want everyone to wear a mask so that if the particles are loose in the air, they are not then coming to you and being absorbed in your nose and your mouth, which is where we believe the disease is contracted through. So, yes, we want you to have a mask. Now, do I need an N95? Or now the new thing on Facebook is the N99s. And the answer is no. If you have one and you want to wear one, you can. But let me tell you something. I'm a physician and I did not routinely wear an N95. And when I got one, I found that they're not all that's cracked up to be. They're very hot. They leave marks on your face. And nobody can understand a darn thing you're saying when you're wearing them. So for the regular public, they're not that helpful. For the healthcare professionals that are dealing in close contact with patients with COVID-19, by all means, they need those masks. So let's leave them to them. And for the regular person that's just going to the grocery store, to the post office, or if you have to work, is going to be out working around people that are, God willing, healthy or believed to be healthy, a regular mask, either the 3-ply that you see people wear normally when they're sick, or a cloth mask is completely fine. So, how do we make a cloth mask? Or you can, like I said, you can order one, but it's going to take a long time. There are lots of videos out there. My Lord, every time I go onto Facebook, I see a new one. So pick the person that you like the best, who seems to have the simplest mask, and go for it. Hopefully you can use materials that you already have in your house so that you don't have to go out. If not, make a list and make a targeted run to the grocery store or to the drugstore so that you can get your supplies. Now, one thing you should have, if possible, is between the cloth layer on the outside and the cloth layer close to your nose should be some kind of a filter. Coffee filter, saran wrap. You can use plastic, but you want your mask to be comfortable. Also, something that some people forget is you have to leave a little opening so that you can get the filter in and out, because you need to wash these masks. If you're just wearing the same nasty cotton mask, then it's going to be full of all sorts of bacteria and potential viruses, and including potentially the coronavirus. So ideally, what you want to do is be able to take the filter in and out so that you can wash your mask and dry it and put it back on. So that takes us to our next point. You want the COVID-19 virus is very, very contagious. We know that. It's also very easily killed, which is a great thing. So, hot water, detergent, put that puppy in the dryer, and you should be good to go the next time you go out. So, that takes us to our next point. Do I have to wash this every time, you're saying? Well, ideally, yes, you do want to do that. And you shouldn't be going in and out of your home. The goal is for us to be sheltering in place in our homes, correct? So you shouldn't be going out, hopefully, every day. And if you are going out, it shouldn't be more than one time out. Get everything that you need to get done and then stay home. So yes, wash your mask ideally in between your outings. Then it goes without saying, but then you have to say it. You need clean hands when you're putting your mask on and when you're taking it off, or heaven forbid if you are manipulating your mask. So the goal is not to manipulate your mask, but hey, things happen. So you either need to have an antiseptic wipe, antiseptic hand sanitizer, or wash your hands when you're touching your mask. Remember, the goal is to keep the virus off of your face and out of your nose and your mouth. If you're touching your hands with hands that have potentially been exposed to the virus, you defeat the purpose. So you think, well, that's goes without saying. Think about it. You get to the grocery store, you've already started pushing the cart in through the parking lot, and you realize you don't have your mask on. Natural response would be just to grab the mask from wherever you put it, usually around your neck, which is not where it should be, and pull it up with dirty hands. So just think twice when you're doing that and think clean hands, clean hands, clean hands, and keep your hands off your face. But if I'm going to be touching my face, clean hand, clean hand, clean hand. The mask does nothing if it's sitting on your head and you're pulling it down or you're moving it down here. So once again, the goal of the mask is to keep your hands off your face. So in doing that, since most people are not used to wearing a mask, the recommendation is actually to wear the mask at home first. So you can get used to it, because it's not as easy as it sounds to actually have a mask on place when you're doing normal activity. One thing people don't realize is that you use a lot of muscles in your jaws when you're talking. So even though the mask may be perfectly fitted when you're not walking around talking to people, as soon as you start talking, that mask that was sitting here could end up down here, which of course means you have to now manipulate it, which once again defeats the purpose. So practice using your mask in your home before you take it out in public. Lastly, there are people that just say, I don't want to wear a mask. I just don't want to do it. Okay, fine. Guess what? You don't have to wear a mask. Wearing the mask is when you have to go out. Stay home. That is the goal. That's the safest way for you to know that you're not contracting coronavirus, is if you stay put in place with only the people in your immediate family that you've been exposed to all along. So stay home and you can be mask free. Going out, please wear your mask. Practice your 6 feet distancing, because wearing a mask does not replace the 6-foot distance rule. I'm Dr. Shelley Glover, and I hope that this was helpful for you in the quest to mask or not to mask. I wish you good health. Please stay home and stay safe.